Hi there. This video is about SGLT2 inhibitors and kidney disease. Kidney disease is an important subject for people with type 2 diabetes. And that's because 30 to 40% of people who have type 2 diabetes will eventually get kidney disease. So it's important to control your blood sugar as much as you can. And that's why I encourage people to take meds if they need them. It's fine to use lifestyle changes. In fact, I encourage lifestyle changes in every way possible. Through exercise, through diet and exercise, through better sleep and stress, and every way imaginable to use lifestyle changes to try and lower your blood sugar. But if you're not doing that, and if you're having trouble doing that, it's important to use meds to make sure your blood sugar is under control. Perhaps it's taking you time to adjust to your blood sugars, and it's taking you time to develop new habits to control your blood sugars. The best way you can control your type 2 diabetes at that point is to take meds. The meds may be temporary or they may be permanent. But if you're going to be developing kidney disease, you want to prevent it. And that's what's fantastic about the new drugs called SGLT2s. Some of them are Farxiga, Jardiance, and Invokana. And what they do is they basically filter out the urine and they remove the sugar from the kidneys, and you pee out your sugar. If you peed out your sugar, the ants would probably eat your sugar. But anyway, on the floor. So you don't want to have ants on the floor near where you're peeing if you're, if you're taking SGLT2. I'm just kidding, but that's true. So if you're taking an SGLT2, it will substantially help you minimize the effects of kidney disease. When you go to the doctor, if there's a risk that you may have kidney disease, the doctor will take two important tests. He'll take the eGFR and the UACR. The eGFR will basically tell you if you're filtering out your kidneys so that you're not having kidney disease, or if you're beginning to get kidney disease. If you have an eGFR of less than 60, you need to watch out, and you need to maybe make sure that you're getting prescribed an SGLT2. The UACR is another test that you need to take. And if that test is over 30, you likely are having problems with your kidneys, and you need to likely take an SGLT2. So what I want to do is I want to encourage you to make sure you take these tests if you need them, discuss it with your doctor, and realize that you can live a lifetime and you can substantially reduce the effects of kidney disease by taking these remarkable drugs and medicines. And you want to make sure you take them. You don't want to delay taking them by trying to do something else. Because if you have high blood sugar, you're going to damage the vessels in your kidneys, which basically filter the urine that is causing the problems with the kidneys. So I want to encourage you to make sure that you take your SGLT2s if you need them. We discussed this in our webinar, and we discussed this in our other programs. So look at all of our programs at solo.to/Joel Steinberg, and come to our webinar on September 22nd and September 23rd. And subscribe to our YouTube program below. Thank you. Right below, you'll see our YouTube program, and you should subscribe to it today. Thanks, and have a great day. Bye.